inferior part, what's this one? That one. This actually is maxillary. Palatine is the back part of the palate. Remember, the maxillary has most of the teeth in it here. Palatine is right there. Then this one, the sphenoid. And then the vomer here. And then this one, temporal, right? That's the part that goes to the zygomatic arch. And then here, zygomatic bone, right? Foramen magnum. And then we can talk about that, but what are those? That's the part that articulates with the vertebra. So this is the occipital condyles here. And then here's the sphenoid, temporal, occipital, frontal. All right, now we get into the muscles of mastication. And again, these are things you're going to go over with palpation. The masseter is pretty much this, for inch, it's the strongest muscle in the body. Right. Doesn't mean necessarily can lift the most pounds, but for pound of muscle versus pound of lifting strength, it's pretty much just one of the strongest muscles. So the masseter is going to be right here. Right? If you clench your teeth, you can feel it pop out here. And then the temporalis is going to be up in here. So you can feel that muscle move when you clench your teeth here. All right. So then those are the prime movers that are going to be the temporalis and the masseter. And then you have the pterygoids and the buccinator, which buccinator here is basically like part of the cheek. And then the pterygoids are the ones that are deep inside here on these medial and lateral pterygoid plates. Right? And they're all innervated. We're not really going to have to know innervations in this class, but basically they're all innervated by the same cranial nerve, the fifth. So then the masseter, the origin's off the zygomatic arch here, and part of the maxillary bone. And then it's going to go into the angle of the mandible here. And then obviously its motion is to close the jaw. And then the temporalis, temporal fossa. And then it's going to go into the coronoid process of the mandible here. And then again, its action is to elevate and retract the mandible. It's kind of going forward like this a little bit onto this coronoid process. It can retract it. So it can pull it back. But its primary motion is to close the jaw. And then you have the medial and lateral pterygoid. So the internal or medial one is going to come off of the medial surface of the lateral pterygoid and then part of the sphenoid. And then it inserts to the inside of the mandible near the angle here. These muscles are not necessarily going to be that critical for you to, I mean, be aware of them. It's more important for people that if they're doing some type of muscle jaw work or something internal working of the muscles of the jaw. You're going in there and putting gloves on and working the muscles. You just got to be careful the patient doesn't bite you. And they're doing things like side-to-side motion of the mandible. And then you have the external, so that's going to be more on this outer wing here. And then that muscle does insert onto the capsule of the temporomandibular joint. And it's going to do protrusion of the mandible and then side-to-side motion. Okay, so now we're moving into the bony thorax or the rib cage. Basically, you're going to have the thoracic vertebra and the ribs. And then also on the front, you're going to have the sternum. So the functions of the rib cage is to protect the lungs and the internal organs, the heart, mediastinum. And then it's going to also be what the shoulder girdle hangs on. Okay? We'll get into the details in the sternum in just a minute. And then this jugular notch, that's going to be right here. All right, so then the sternum has three different parts. Right? You have the manubrium here, and then the body, and then the xiphoid process. So then this jugular notch, or also called the suprasternal notch, it's going to be used, I think, as a landmark for palpation as well. And then right from the outside here, what are these two bones that come off of here? Yeah, collarbone or clavicles. And then this sternal angle, or it's also called the angle of Louis, that's another thing you want to be aware of for palpation. So all of these things on here that are underlined in the notes here, the manubrium, which is going to be here. If you go right down from the jugular notch, there's the manubrium. And then you'll feel kind of here, it makes kind of has a little bit of a break in it. You go right here, you can sort of feel a little bit of a junction between the two bones. We'll go over that a little bit more when we do some more palpation stuff. So then these would be the clavicular notches where the clavicles attach here. Jugular notch, sternal angle, or angle of Louis. And then the xiphoid process is the part coming down on the bottom here. So you're going to have 12 ribs. Now, these other ribs, which are considered true ribs, this part here, this lighter color is actually cartilage. So the true ribs are the ones that either directly or indirectly go into the sternum. So you have the first 7 are true ribs, because you see this one indirectly attaches onto that cartilage right there. So you have the false ribs, which is 8. Sometimes people consider all the way to 8 to 12, but the last two, 11 and 12, are the floating ribs, where they just end right back here. Okay. See these here, they have little tips right there. And then those are things that we'll go over in palpation too, to be able to find the tips of those last two ribs. So then, 1 to 7 are the true ribs, 8 to 10 are false, and then ribs 11 to 12 are the floating ribs. And then on the ribs, the actual rib itself has the head of the rib here, and then the neck, or the angle, or the neck here, and then it comes into the angle of the rib, and then you have it coming all the way over here. And it's going to attach either to the sternum directly, or to the cartilage if it's a false rib. And then this just shows here how it attaches to the vertebra here at the head of the rib, and then it also articulates with the transverse process. And then as it comes around here like this.